Welcome back to Your Morning Calgary. For years, dermal fillers have been a go-to non-surgical option for people hoping for a more youthful appearance. However, many now are experiencing what's being called filler fatigue. To tell me more about this, I'm joined now by facial surgeon Dr. Christina Zachary. Good morning, Dr. Zachary. Great to have you in studio.
Good morning. Thanks for having me.
Let's talk a little bit about the work you specialize in and a bit more about filler fatigue as well, what you're hearing from patients.
Great. So I'm an otolaryngology, which is an ear, nose, and throat head and neck surgeon, and my focus and expertise is facial plastic surgery. And I'm seeing a real shift, cultural pivot to a more natural aesthetic.
Right.
And that's where filler fatigue starts to come in.
And basically what we've kind of seen, we have some examples here with celebrities, is that maybe too much filler over time can give you a bit of a heavier appearance. Is that true?
Exactly. So filler fatigue is actually the look and feel of too much filler over time, and it makes the face look more doughy. There's less sharp transitions between facial zones and subunits, and just overall an unnatural, too full look.
And how is this happening? Are people just doing too much, thinking that it's going to dissolve too fast or something like that?
Excellent question. This comes from the fact that filler has been used more of a lifting tool or a sculpting tool rather than a small volume tool where appropriate. So it's not an anti-filler comment, but it's more use the right tool for the right problem solving.
Yeah, that makes sense. And that leads me right into my next question. When is a surgical option maybe more appropriate than the filler route?
So when a surgical option is more appropriate is when you're trying to lift or sculpt or shape the face in a way that volume won't do that. So for example, if eyelids are too heavy, an upper eyelid surgery might be more appropriate than filling under the brows, for example. Or if the face is sagging, then a facelift might be a more appropriate option than trying to chase a lift with syringes.
Right.
That is not to say that there's less demand. It's more of a comment on a change in style and appropriate use of fillers. Actually, the American Academy of Facial Plastic Surgery released a survey in 2025, and they flagged filler fatigue that early on.
Wow.
And they mentioned that 90% of facial plastic surgeons are still doing injectable treatments like filler and neurotoxins very commonly. So it's not a pivot away from non-surgical treatment. It's more that surgery has become a little bit more part of the discussion now, and it's a little bit more acceptable to explore that definitive treatment.
When would you suggest maybe the filler option be a better choice for somebody?
So the filler option is great when you need volume. So if you have a little bit of volume lost in the cheeks, for example, or in the lips, so a little bit of volume goes a long way. You don't want to start overfilling. When things start sagging or looking overly puffy, then it's maybe time to have that conversation. So I want to clarify that all of these treatments are medical treatments. They do have risks and they do have limitations, and it's very important to consult with the appropriately trained doctor or nurse practitioner, for example, to know what those risks are before you delve into this world.
Such a wealth of knowledge. Thanks so much for coming in today and breaking this all down for us.
Thanks for having me.
And again, if you would like to connect with Dr. Zachary, you can get more information on facialcosmeticsurgery.ca.